Welcome to the Rotunda, the longest-running maternity hospital in the world. It has seen the birth of almost 1 million Dubliners, and some 24 new babies are added to that number every day.
Yeah!
This don't feel good. Is it coming out? You don't want the baby to come out and fall on the ground.
It's a place of extreme highs and devastating lows.
Why not cry?
Agony and ecstasy, all happening second to second. We're there for the most intimate of moments as people experience events which will change their lives forever.
You're going to meet him now. You're going to meet him very, very soon.
Happy birthday!
Events to be remembered and retold for generations to come.
Okay, one more big push there now. Push for me now, push.
It's not in vain that society says it's a man's world, because truly man can have a child at any age providing their sperm quality is good. But every woman should realize that she only has approximately 500 days in her whole life when she can conceive. It's sort of a wow moment where everybody's jaw drops saying, I can't believe this, but this is the truth.
It's 8 a.m. and Nula and Mark from Cavan are being admitted into a delivery suite for the birth of their second child. They arrived at the Rotunda yesterday.
I met Nula fresh from the annex. She was in early labour. We were bringing her in for an induction.
It gets to that stage.
Oh my God, I couldn't get socks on earlier on. I was like, what?
Her waters had broken the night before and she was doing bits, but she wasn't kind of getting to where she needed to be to deliver.
15 years together today.
You're what?
15 years together
15
today.
years together today? Aww.
Oh yeah, well it was her anniversary, wasn't it?
Yes.
Yeah, she just threw at me.
That's so... You don't look happy at all.
Like, why do you always remember dates? I'm like,
Oh, that's
yeah.
so sweet.
I thought she was beautiful. And then kind of got on with her, that was about it, like so.
Yeah. Thanks, Mark. Really appreciate it.
It's right.
So we're not having any more kids after this one?
I'm quite happy with boy, girl.
Yeah.
Well, that's the gentleman's family. That's what they say.
There you go.
You see? Is your little girl at home excited?
Oh yeah.
Yeah.
She's super excited. She wasn't too impressed with Mommy was staying in hospital yesterday
no.
though. She was like, he could just stay in there to my birthday. Just come home now.
When's her birthday?
May.
Into me.
Absolutely not.
Maybe it's a bit selfish of me as a midwife, but I like to get into their world and immerse myself.
Tell me, how are you planning to feed this baby?
I breastfed Ruby for 4 years.
4 years? Stop.
Did ya?
You're great.
We had to have a whole celebration afterwards. There was a cake
Stop.
with boobs on it.
Get her.
You know.
Goodness.
Do you know what? It was me being selfish as well. It was our time, you know, when I went back to work.
Yeah.
So yeah, I loved it.
But equally, I feel that I share with them.
What age are your two?
My two are 6 and 8.
Oh, okay.
The 8-year-old's great for going to school, but the 6-year-old's not so great. Every morning, like, you just know, like, you open the curtains, I'm not going. And I'm like, oh God. It's like fighting with a teenager. It's about having a relationship, feeling confident with the person you're looking after. And I think once that's there, you know, any issues that arise, people aren't as scared. They understand that you're there for them and their baby, and they trust you. And it's a very important task.
You look scared, Mark. You look scared.
Tired.
About 32 years ago, I was working in the paediatric unit, and there was a very preemie chimpanzee born in the zoo. Oh my God. And I came on one day and they had actually, instead of taking the incubator from the paediatric unit over to the zoo, the chimpanzee was brought to the paediatric unit. And it was the chimpanzee was down in isolation, So yeah, it was being bottle fed and everything, yeah. That is very true.
24 babies are delivered every day in the Rotunda. Some have to have urgent treatment in the intensive care unit. Baby Ryan is on a ventilator after a critical first 48 hours of life.
Ryan was very sick when I met him. I was called at about 8 o'clock at night when he was about 8 hours old to review him because he developed a progressive increase in his oxygen requirement. His skin was sucking in between his ribs and he developed nasal flaring. He was floppy, he was grunting, he was acutely unwell.
The hospital intensive care team rushed to save Ryan's life, leaving his mother Milena full of questions.
I didn't realize what's happening, what's wrong, what maybe I did wrong in my pregnancy. I was like, why? Why? Because all the time he was good, he was okay. Every scan he was okay. When they took the baby, I saw him see. I feel like a little bit pain because I saw his hand was purple and then I could hear him crying and I told him his cry is a little bit strange.
So when I examined him, I found that there was decreased air entry on the left-hand side of his chest. So my diagnosis was that Ryan had a collapsed left lung and a pneumothorax, and that he had pulmonary hypertension. There was a risk that Ryan could have died. I intubated and ventilated him, so I put a little plastic tube into his windpipe and I hooked him up to a ventilator to help him breathe.
When I see him there, was connected to all that machines and all that wires and all that, it was more than upset. I was really sad.
Every time when I go there, he do that with the hands, help me. I don't want to stay here. And it was really sad to me leaving him. Maybe he wants me, maybe he cry and I'm not here to calm down him. That night, my sister tried to call me. Here was 1 in the morning. And I was annoyed, I sent a text on WhatsApp, why are you calling me? It's late here, I need to sleep, I need to try to take my milk. And my father, he had an operation. I realized, I said, is something wrong with my father? I answered the call, and then she told me everything was going on with him. He was already in coma. They didn't want to tell me what's going on there because of what's happened with me, with Ryan. So when they called me, he was already in coma and I couldn't talk with him.
After 40 hours on the ventilator, the medical team want to see if Ryan can breathe on his own.
Okay, Ryan. Now you are ready.
A big yelp, I'd say.
Yeah. Now, Ryan, are you ready? Okay. Now you can cry.
I was crying all night because I think that tube in the mouth was the hardest one to see because he wanted to take it out all the time. It looks like he was asking for help. When I talk to him, he'd do like that.
While facing the worry and stress of Ryan's precarious health, during the night, Milena received some more news from her sister in Brazil.
She called me again and she told me he passed away. And I was like, why? What's happening? Too much problems at the same time. Why that's happened with me?
72 hours since birth, Mum and Dad get a chance to hold baby Ryan for the first time.
Oh, it's amazing, his eyes. He looks like me, like he knows me from somewhere. Oh, it's so nice, so good.
Yeah, Daddy gonna see you. Say hello to Daddy.
Wanna cry a little bit? I don't mind. I don't mind.
Yeah. I want to boobies, Daddy. Come on, come.
Oh. It's the first time when I hold him, and basically since he born, I never hear him proper crying, you know, like that deep crying, you know, like screaming. I have another son, you know, like, but it's 18 years old now, so it's a long time for me to have this feeling again, you know, like it's. I think it doesn't matter how many kids you can have, just it's a new feeling every time. Hey. Hello. Hello.
The intensive care staff will monitor baby Ryan's breathing and blood oxygen levels over the next 24 hours.
I want to stay here looking.
Milena has to go back to her ward with other mums and babies, while Ryan stays in intensive care.
It's empty upstairs. All moms with babies in.
I remember I had one couple. It was her second baby, but it was his first baby, and he missed the delivery, and the baby was in her arms when he came in, and he had his Tesco t-shirt on, and he came running in, and he goes, "Oh my God, Jacinta!" like that, and we were all just like bursting laughing.
Oh, too hard.
Almost 3 hours since arriving on the delivery suite, Nula is trying to resist the lure of an epidural. Mark is doing what he can to try and help.
Oh. Oh. No touching. Just have to do myself. I don't know. Do you know what to do? Really, like?
Sorry to bring coffee.
Of course, that's all right. No problem at all.
I know, yeah. God,
he's very good.
God, love them.
Well, it's great that you can say that and you're in the height of it, so, you know.
I know, yeah, but you're right, they don't know what to do.
They haven't a clue.
Look left, right.
Yeah. Try this, try that, try this again, try that.
Don't touch me. For the whole of my labour and Ruby, I think Mark was just holding on to a face plot. Looking like you're in action. Any minute now, I'm going to have to do something.
Is it really bothering you?
Yeah. Oh, wow, it's like the proper inside of it. Oh.
Try the other one. The other one.
Oh my God.
No problem.
I know. No. Ow. Ow. Oh, back to the same born position.
Well, I was doing a lot of repositioning. I knew why baby was taking some time, and it was just that baby had kind of gotten himself turned into a funny position. This baby was definitely bigger than her last baby, I think significantly so. He feels quite long, so even possibly up to 1 kilo heavier.
Oh my God. It's coming out.
Will I go and get things organised for an epidural? Yeah?
Please.
No problem at all, Nula. No problem. We thought you were MIA, Mark. Nobody's joking.
Didn't think. No, I was just checking on Ruby and stuff. She's got some.
I'm gonna pop outside to grab drugs for a second, okay?
No.
Will you fix my sock down there? It's really annoying. You put them on.
What? Friend, good. Good.
I'm tired.
I know you are. Just try and get whatever sleep you can, like.
I can't.
Come on, stop. Relax. Will I give baby back to you there? Oh, sorry, little baba.
Wake up, you baby, wake up.
After 6 days in intensive care, baby Ryan is well enough to move to a postnatal ward. But for Mam Milena, her new baby is a bittersweet reminder of the father she just lost.
Like, I'm really similar to my father, so everybody say he's similar, like he looks like me. So he gonna have a little bit of my father as well. My father has like these big ones. Yeah, really long. My father will always have a really long.
Mais fácil meu pai sair daqui primeiro do que o bebê.
He's saying, where is Ryan Fernando? He come or won't come? He always asks us, I want the baby in the family. I want the baby in the family. Nobody give me his baby. And I was happy to give that gift to him, to my mom. He just saw one picture of him. I tried to talk with him, but he was in coma. And I just told him some words because he can listen to me. And his heartbeat started to be really high. And my sister asked me to stop, to don't get worse.
It was so fast, everything. Like, even one of the nurses say, like, you know, it's like that cycle, somebody coming and somebody leaving.
I think everything, like for my sister as well, they always say, keep sending videos to see him give us a piece as well. We can smile a little bit, so keep sending for us to have a breath about what's happening as well. So he came in the right time.
Can't wait for Love Island. Draft. I don't want to. Do you not? No. Oh, it's so good. What is it? They have to go walk on, like, and the girls walk in, and then they have to walk forward for a fella that they like, and if two people walk for the same fella, like the fella has to pick which one he likes and stuff, and then they have to match for a few days, and somebody can come in and say, no, I want your fella where you're left on your own. People get eliminated now.
Yeah, but how do you get eliminated?
Because people ring and say, who do you want to go? And they say, I want Alison to go because she's annoying me.
It's 2 p.m. in the Rotunda Hospital. It's been a long day for Nula and Mark. With her labour pains increasing, Nula is waiting for the anaesthetist to get her epidural started.
Oh my God.
What's true?
She's a multip, so she's a para 1. She's an induction for prolonged trauma. She's 3 to 4 centimetres, not an oxytocin, wants an epidural.
In the textbooks, it's been described as one of the worst type of pains you can get, and women generally have a higher threshold for pain, so if they're really distressed, it must be horrible. Have you seen an angry cat? You know how they arch their backs when they hiss?
Mm-hmm.
Can you do that? So, shoulders down, chin on your chest.
Yeah. Relax the arms, shoulders really relaxed.
Try and curl up around that pillow. This is a dragon, right? So I'll just go under its chin. We're not going to go through the ink itself, it's just through the chin, okay?
Oh, okay. We need to stop for a second.
Contraction?
No, I got a kick somewhere.
Oh.
Yeah.
Kick?
Not you.
Just trying to avoid a tattoo.
Oh, don't be avoiding the tattoo. Don't be silly. I don't care about the tattoo. It's been there since I'm 17 or something.
Has it?
Yeah.
And a dragon? What possessed you to get a dragon?
I just like dragons. That was it.
Good, okay.
I just get a tattoo to deny my dad. That was it. So don't worry about the tattoo.
I might go straight through the eye of it.
Yeah, I don't. If that's what you're concerned about, don't.
That's it, well done.
Yeah, it was the eye of the dragon.
That's it, keep still.
It's not that. I'm getting a contraction right now.
Okay, let's
Sorry.
breathe through it. Breathe through it.
No, don't straighten your back.
Hold your position, good girl. Good girl. I know it's tough, Nula. I know, just
You might
this
feel
one,
something
okay?
like an electric shock at the same time. Let me know if you do. And let me know which side. Anyway, we're done. Keep your jaws in.
Good girl, Nula.
Love you.
Thanks.
It is a sense of satisfaction because when you walk out of the patient's room, you know you've helped them eliminate the negative aspect of something that's incredibly beautiful.
They said they're going to call their baby after you.
Good.
Mark saying that because
Parvin is a good baby name.
Parvin.
Yeah, especially in Ireland.
Well done. He's gorgeous.
My son was born in the Rotunda, and for the likes of me, I'm about as useful as an ashtray and a motorbike. When we went down to the theatre, and next thing I heard a baby crying, and I was thinking, oh my God, you think they'd stop those babies crying? Because they're going to be disturbing my wife, and I didn't realise it was my own.
It's 7 p.m. and Nula has been in labour for 11 hours. Midwife Daniela's shift finishes in just an hour.
Stop looking there and smiling.
Come on, will you?
Well, I'm telling you what, Ruth, we have to, we need to get this baby out by 10 past. We need to get this baby out. I need to, I have to.
You have to get out.
I want to see the baby.
There was me, Daniela, and then there was Mark just there. God love him. And I think I found out early on that she was finishing at 8, and I was like, oh no, you just can't leave me, Danielle. You're not allowed to.
We're just going to do it.
Don't leave me, Danielle.
I'm not going to leave you. We're going to do this. I'm very determined. I can be as stubborn as this baby. I'm just not going to take no for an answer. That's just how it is. In this particular delivery, I was just so excited because I thought I was going to miss it. But I said to Nula, I was definitely staying to see this baby because we'd put in so many hours. You ready?
It's going to be pissed off. Don't go on.
Oh, yeah.
That's why they come out crying, because they're pissed off for coming out.
Ready? Fill your lungs. And a huge push, Nula. That's it. Come on, keep it going. That's when you're moving them. That's when you're moving them. Come on, good girl, good girl, good girl, good girl. Okay, and again, sweetie. That's it. Go really, really hard. Come on. Come on. Good girl. Okay, that's it. Fill your lungs. Push right down. Push right down, right down, right down. Okay.
Breathe in.
Good girl. Really big push now. All the way down, Nula. Good girl. Okay, take 1 second. Let me feel that tummy. Come on, breathe in. And big push down. Come on, all the way down, Nula. Come on, bit more than that now. Good girl. Right down, right down, right down, right down, right down, right down. Good girl. Do you know, I can't even imagine the impact of it yet. I know some of the midwives that we work with at the moment, the senior ones, have met some people that they've delivered. I've been there when that's happened. And it's just... it's just jaw-dropping. I can't believe that these people are here with somebody that's delivered them. Keep it coming, keep it coming, keep it coming, keep it coming. Come on, don't stop.
8.
Amazing, and again, come on, don't give up yet, don't give up, come on. Good girl, Nula, come on, that's it, Nula, that's amazing. Okay, good girl. Now, that's it, now put your legs down. So let's just bring this one out. Put your legs down for one. That's it. Now listen to me, okay? Good girl, and again, small push. How could it get old? There are people that are going to be on the planet 60, 70 years from now doing amazing things that you helped bring in safely. I would have more kids myself, it's that magical. Big push into the bum. Good girl, and again, come on, push for us. Push.
I just took the cord out around his neck.
Hello, mister. Yeah, please and thank you. Wait, hold on. Let's go see Heather.
That's all the super stuff. Little Manny.
Come on, what's up with you? Where are you in there? I told Heather we needed to get a paediatrician into the room because it was coming up on 2 minutes and baby still hadn't given me too much of a reaction. Yeah, you're going to go in for suction? I would always kind of be cognizant of the parents, but in that moment it's just 100% more important that you focus on baby and give all your attention to baby. Baby's a bit flat, Gillian.
That's all you needed. Just a few more then. That's it. There we go.
These cords perfectly fine.
Congratulations.
What was that about? What are you doing to me? But as soon as we got more senior people into the room, colour went perfect. He started crying and we said, that's perfect. He's done it himself. Oh my God. You are so bold. You are so bold. Was it a bit horrible? I just want to make sure I'm happy. I've got to be happy too, you know. It's not all about you. Let's go say hi to Mommy. Now, Mommy. No. He is like, this is not right.
You're so perfect.
Hello. Yay, he's born. Yay.
He's beautiful, lads. Well done. I'm going to leave you alone now.
Thanks so
I'm
much,
going to back out of
Danielle.
the room.
Thanks a million, you were amazing.
So quick.
Thanks, Danielle.
Well, congratulations. I can't even hug you over the bed. It's, congratulations. You
Thanks.
both did great,
Brilliant.
and I'm so proud of you.
Thank you.
We never doubted you. Right, Roisin, have a good night. See you guys later.
That moment is the most amazing moment ever. Like, for anybody that has kids, they completely understand. They go, oh, it doesn't matter what you've been through, what you've done. You're like, oh my God, they're here. Wow. You're like, your voice seems familiar. Were you giving out for the last 9 months? Like, I don't know what I was reading the last day that said the men weren't present for deliveries. I mean, the fact that you guys are there and that should want to be there, like from day one, I mean, it's amazing. It's just great. Like, and like Mark was there holding one leg and Danielle is holding the other. Do you know what I mean? That was...
Had to be done. Oh, you're tired,
That
are
was
you?
very tiring.
Well, they do think that I am the mother of the emergency room. I do bake an awful lot for them. I bake cakes, I bake savouries, I bake focaccia bread. They ask me on a Friday when I come in, well, what have you baked today, Suzanne? I'd say your speciality, your goat cheese tartlets.
In the intensive care unit, new father Martin is keeping an anxious watch on his premature, 1-week-old baby, Nathan.
Was he waking up every so often, yeah? He's alert. He wakes every so often, does he?
Yeah, he will wake up later on. Okay?
Oh, yeah,
At
so...
the moment he's sleeping.
Ah, yeah. But the other day he was very restless. I think that was probably the oxygen as well. A bit restless. He was...
Nathan's mum Emma was just 25 weeks pregnant when she was rushed from her home in Westmeath, 100 kilometres to the hospital.
There was absolute pandemonium, lights blazing, gunning it up the road. The on-call doctor comes in, checks me, and goes, I'll be honest with you, baby's feet are actually out of the cervix. He's kicking out of the cervix. He was that low down. And I was like, what does that mean? She says, very high chance baby's coming tonight.
Is the heart dilated?
It is a little bit, yeah. There's no steel in the celiac, though.
Is there none?
Nope.
Okay. Okay. Nathan's mother was in early labour when she arrived, but that advanced very quickly and she ended up undergoing an emergency caesarean section at 25 weeks gestation.
Like that, he was up and gone. I didn't get to
So
see
he
him.
was crying, didn't you, a bit?
He'd let a noise and he was trying to breathe. So all I could think was, he is a third the size of my first child.
Born weighing 880 grams, Nathan had been making progress, but there's been a setback, which the team are assessing.
The on-call team overnight noticed that he was getting more tired, that the level of oxygen in his system kept dipping down, so the time was right to actually intubate him, to put him back on the breathing machine so that we can support his breathing.
I have to say, though, he's after coming along, like his skin and everything.
Yeah.
Big time, like in the last week.
Yeah. So he's overall he's doing well, but as you noticed, we had to pass the tube back to help him breathe.
Oh, is that because he's getting tired, I heard?
Yeah, there were signs that he was getting tired. We're also looking for infection because that can be a cause of it.
Any sign of anything?
So far, nothing, but the bloods take, 24, 48 hours to
Oh,
come
yeah,
back.
but and it's not an immediate...
Not an immediate thing,
Yeah.
but we have...
So far, he's had sepsis, he's had virus, he has suspected pneumonia, suspected meningitis. He's been intubated 3 times. He's been blood transfusion. That's in only 2 weeks.
Yes. We've also scanned his heart to see whether the heart is contributing to him being on the breathing machine, and there is some evidence that it might be. Is it okay? But every day spent off the ventilator is better for the lungs because you actually cause damage to the lungs by keeping the baby on the breathing machine. And in some situations, babies do end up being stuck on the ventilator, and we do have options on how to deal with that.
Yeah. And how long do you expect them to be on this?
That's the million-dollar question. I don't know. Anything else I can do for you?
I think that's everything. I must ask you everything now with the kitchen sink, but...
Emma and Martin have only been together for 7 months. And while Emma has an 8-year-old son, this is Martin's first baby.
I never thought that I'd get to this stage. So I had myself kind of like written off while all my friends and everything were getting married, having kids. I never thought, like, when people found out, they were shocked. I don't know if that's a good thing or a bad thing.
He's looking great. I feel a bit better now, but it's a bit, you know, when I heard about the ventilator this morning, it was like, oh, kind of the end of the world, but I'll admit I had a bit of a breakdown. That happens, though. But you're expecting setbacks, but you just have to think logically about it. And then I was saying to myself, see, I suffer from mental health anxiety, and I said, am I cut out to be in this position? I'm doubting myself. Because I should be there to support her and him, but I'm kind of finding it tough. Like, it's just the whole thing is daunting. Like, I'm thinking too far ahead of myself, to be honest with you. So, I mean, I'm delighted with his progress, but it's still, I can't even think. When I'm home, it always goes back into my head, even when I'm enjoying myself, I say, oh, he's in here. It's not easy.
The thing to remember about neonatology is that we're not really just only caring for the baby, we're caring for the whole family unit. And that's the whole premise of family-centered care, and that we provide care to the parents as well as the baby in the intensive care unit.
And at the moment, he is still in a very precarious position because the slightest thing could mean he's not coming home. We're going day by day. That's literally how we are at the moment, that we don't think long term because of, and I don't mean to sound very morbid right now, but realistically, tomorrow everything could change.
Guess what I did for you? I delivered the baby. Yeah, I did. Oh, big time. Yep. It was the aromatherapy that did it for her. Oh, big time. Yeah, I did. Yeah, I did. Yeah, I did. High fives everywhere.
Your first baby in Spain.
Yeah.
On the labour ward, a new shift is beginning. Maria Jose has arrived with strong contractions.
I'm going to have a little... Oh. Okay, just a plate there after this. Here, do you want to use your gas? Gas if you want.
Maria Jose's husband has to mind their first child at home, so supporting her today is friend Maria.
Yo conocí a María aquí en Dublín. El Señor la puso en mi camino porque nosotros nos conocimos por la iglesia.
Can I give you that in your hand because I need to do a few things? Maria, if you hold it for her, is that okay? Thank you.
Cuando tú estás en un país extranjero y no puedes tener a tu familia cerca de ti y tu familia sí te da su cariño, pero no lo puedes palpar, ¿no? Los amigos se convierten en tu familia.
Roisin will go into you after she collected her 39 delivery in room.
Oh, okay, yeah, no worries.
And then yours will be the 40th.
She'll have it. Yeah, she's going to have that. She's going to crack on. Those waters will go, and then she'll have the baby.
That one, the head is really low down. So
yeah,
hopefully,
once she
as soon as she delivered that one,
she was in established labour. She wanted an epidural. Do you feel you need to push? What do you feel? Okay. And everything's going to be okay. It's going to be okay. You're going to have this baby. She's already had a baby, so that's telling us things are happening. And we're probably thinking she's progressing quite quickly. Hello. Hiya.
Hello, how are you? My name's Fiona. I'm on the anaesthetic doctors, okay? Here, you want an epidural?
I need the epidural, please.
Maria Jose had a difficult time with the birth of her first child, Clara, which is adding to her anxiety today.
Was it? Did you have any problems with the epidural the last time?
Un viernes me parece a las 8 de la mañana y no di a luz hasta el día siguiente a las 6 de la tarde. One moment, one moment, one moment, one moment, one moment, one moment, one moment. Ay. Me pusieron más epidural de lo recomendado y mi cuerpo se paralizó de hombros hacia abajo. Entonces no sentía, no podía empujar, o yo empujaba pero no de la manera adecuada. Entonces el bebé estaba muy cansado y decidieron llevarnos a quirófano.
It's okay, it's okay. Keep breathing, keep breathing, keep it.
Con Clara estuve casi 6 horas sin poder verla, entonces fue mucho más difícil.
Now you're going to feel some pressure, okay? Just try and hold still, you're doing great.
You've got this, you can do
Y
it.
entonces pues tenía esa preocupación dentro de mí, no sabía si iba a haber algún problema. Sí, en fin, pues todas las preocupaciones que tenemos las madres en ese momento, ¿no? Que no sabemos cómo va a ir todo. Thank you. Sorry.
You're doing amazing. It's very hard. You're doing amazing.
Pero a lo mejor no sentí ese calor humano que sí he sentido aquí, ¿no?
You are superwoman.
No, I'm no superwoman.
Well, when I had my first baby 40 years ago, I'm not saying it was like the snapper, but you could actually smoke in the wards. Family members would come up and they'd all be smoking around and nothing seemed to matter. The patients like ourselves, if you did smoke, you could have a cigarette in the ward with an ashtray beside you.
Yeah, no problem. I'll grab you. If you just want to wash your hands, I'll grab you one, okay?
With fragile 2-week-old baby Nathan in an intensive care environment, Mum Emma hasn't been able to hold him yet.
When I had my first son, he was in my arms immediately. Like it was literally out right here, and it was the best feeling in the world. But this time round, you are partly afraid of going near him and
terrified.
Then as well at the same time with the setbacks with the infections, we couldn't touch him. Usually he's a bit more livelier, but I think we're sleeping. I've never seen his face free of all the tubes, not even when he was first born. He was whisked away so quickly and he had to be intubated so quickly. I didn't get to see any of those features yet, so it'll be interesting to see what who he takes after when all that comes off. It'll happen eventually. He just had to be stubborn and come too early. We've gone the blame, well, I have gone the blame game route where I wonder where my body went wrong that he ended up here so early. And I know people will say I'm daft for thinking that, but it's hard not to. You have to wonder what you did that you shouldn't have done. Like, did you move wrong? Did you eat something wrong or something? That he's here 3 months early, because up to that point my pregnancy was relatively normal. So it's hard to know why he's here, but sure. He likes to curl up like that. He's like his mother. I sleep on my belly too. This kind of thing just happens. It's nothing to do with anything you've done. It's just, sometimes it's just what it is. And I'm just lucky that we're at the stage in medicine now that a baby his size can survive. Because when I was a child, this wouldn't have been possible. Hi, Nathan.
How are you keeping? Welcome back. Good.
Dun,
Yeah,
dun,
no, I am.
dun, dun.
It's only 30 minutes since Maria Jose first entered the delivery suite, but she's already dilated enough to start pushing.
Give a big push down. Give a big push into your bum, Maria. Let's see if we can see baby. Big push down.
Into the bum.
Really go for it. Go for it.
Right
Push
there.
it away, push it away.
All into the bum.
No, that's not a push. What's that? I know it's scary. Okay, with the next one, Maria, we can have him here with the next contraction. Scared. Push. Come on, biggest push down into that bottom. That's it. Keep that one.
That's it.
Another
Keep
one.
going.
Another one. Go.
Come on, push your baby, push your baby, push your baby.
Big push, Maria Jose.
Big push, big push, big push.
That's
Claro
it.
que
Keep
puedes.
going, keep going. Maria, just blow now. Venga, venga.
His head is almost out.
Chin
is out. Amazing.
Okay. We just lie back a little bit, maybe. Just.
Baby's head is here. With the next pain, I want a really, really big push. Pain, I'm gonna really, when you push it, I'm gonna give you a big lift up of these legs.
And press them out even more. That's it. Well done. That's
Just
brilliant.
loads of space for baby.
He's trying to rest the turtleneck in there. Yeah, definitely.
Can I just get a pair of hands? It's just a bit turtlenecky.
Louise, the midwife, came out from the room and felt that it might be a difficult delivery of the shoulders. So, being the CMM2 in charge, I went in as she anticipated there might be difficulty, and she was right. The baby's head had delivered very slowly, and then she noticed something what we call turtlenecking, where the baby's kind of pulling itself in and out. So when you're thinking about something like that, there's different procedures that we go through, and that's exactly what we did.
Okay, we're going to get the legs up and out. Good girl. Nice big long steady push now, right down into your bum. That's it. Good girl. That's the one. Come on. Right down into your bottom.
Keep it coming, keep it coming, keep it coming.
Good girl.
The shoulders do get stuck and very difficult to deliver, and your time is ticking on between delivery of your head and the delivery of the rest of the body. So your concern then is for baby, and when you're delivering like that, you're also concerned maybe you could fracture a clavicle, or if you don't deliver quick enough, then baby, the lack of oxygen comes into it.
Ya casi, Maria Jose, ya casi.
Good girl. Coming up. Good girl.
Ya
And we have
casi,
it.
Maria Jose,
Good
ya.
girl.
Venga, venga, ya casi.
Okay,
ya.
keep pushing it.
Well
done.
Venga,
32.54.
Yeah.
That's it. Well done.
Was he a bit shook?
Yes. Why not cry? Shoulders went out, yeah. Oh, you would put out a reg call? Yeah. Put out a please. Sorry, I thought you put out shoulders.
Baby was stunned, didn't take a breath straight away, didn't have a full tone.
This is silky. Just give me Why not cry? Why not cry? He's going to cry now. He's just coming round.
So you certainly, have that moment where, yeah, you get a bit panicky, but you have experience and training.
Come on, Munchkin.
Your heart is in your mouth as well, and you're just hoping mom and baby are going to be okay.
Congratulations. He's okay. He is. He's lovely. He just no cry. Well, he is good. He's crying. He's trying his best to cry.
You say true.
Yeah. Oh, I'm telling you the truth. I am telling you the truth. These are the baby doctors here with him at the minute, and one of the baby nurses, and he's lovely. He's pinking up. Do you hear him giving out?
Oh,
do you hear him?
yeah.
Do you hear him? Do you hear him?
Here and there.
Well
He's
done.
okay.
You
He's
did
just
amazing.
a bit shook coming out.
You did amazing.
You were super. You'll be over to you really soon, okay?
Is he lovely in pink now? He's lovely. He's fine. He's fine. What are you going to call him?
What?
What are you going to call him? Breathe arterial.
Jorge.
Jorge.
George. Oh, my baby.
Oh, it's wonderful, and every delivery is so different. They're all so individual, and it's an honour for us to be actually present at somebody's birth, and they'll always remember you.
Now, I'm going to actually put his little tummy to your tummy. Okay, just so till he catches his little breath.
Oh, look at him.
Now, we'll just leave him lying that way on you. Is that okay?
Thank you.
Not at all. You're welcome. You're welcome.
Es algo extraordinario y que no se puede describir, ese tipo de sentimiento no se puede describir con palabras. Como que tu corazón rebosa, ¿no? Y serán para mí y para el resto de mi vida lo más importante, claro que sí.
It just took the suprapubic.
No, we just...
church up here as well, and then to the reg.
The girls are great, you know, huge support, and when you've, you know, a good team on, it works. You know, that's what it really does, it works. But I job share, so I can do the 4 nights and switch, you know, turn off for the weekend. It's hard on the girls that do 7, you know, it's constant. All is good, and the PHs were perfect, and the baby's fine.
And she was actually on the way anyway.
Throughout the birth, Maria Jose's husband has been waiting anxiously at home for news of the arrival of his baby.
Estaba muy triste porque yo no estaba ahí apoyándole a ella. Como marido, como hombre y como el padre. Hello.
Hello.
Say hello, Daddy. Qué cosita más chiquitita. Qué pequeño. ¿Cómo está?
Muy bien.
Qué cosita más chica.
Oh.
Por fin voy a poder jugar al fútbol.
De broma, decía que ahora tenía que repartir que ya no íbamos a ganar las mujeres siempre, que ahora era consensuado. Éramos 2 y 2. Oh.
Y esto está en tu barriga.
Yeah, in my belly.
Mira, 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 mira. Mira, mira, linda. Mira. ¿Has llorado? ¿No?
When born, yes. When born, cry. But now, no. Oh.
I can actually see your face. I can see your face.